My name is Melissa Ledesma, and this is my complete health assessment. We're gonna get started. Okay, how are you doing today, ma'am?
Good.
Good. Do you know where you're at?
1537 Mountain View Drive.
Perfect. And your name?
KL.
And your date of birth?
01/23/92.
Perfect. Okay. Patient appears to be alert and oriented type She knows where she's at. She looks her stated age. Her skin looks good, a good color, a tan, olive tone. Her nutritional status looks good from just from looking right now. And her mood and her affect seems appropriate. She seems to be in a good mood. Well, she's laying down. Her posture seems good. She moves freely, has free movements. She communicates properly. Her speech is well articulated. What's your first language? Spanish. Okay, but you speak fluent English as well?
Yes.
Okay, so patient is bilingual. First language is Spanish, and she is able to communicate with both fluently and perfectly fine. Okay. Ma'am, do you know what your height is?
5'8".
5'8", and your weight?
146.
Perfect. Okay. At this time, I would normally do that myself, do the measurements, put her on the scale, and then I'll have that. I just ask for it. Okay, great. At this moment, you would also do the Snellen eye chart, and this chart is to measure their vision acuity and how well they're able to see. You would have them step 20 feet from the Snellen eye chart and have them read them off the lines, the lowest line as possible. And the normal vision is 20/20, and that's what you would want. That's what you would want to have. Because we don't have it, we're just gonna keep going. All right, I'm gonna take your pulse. All right. Take the pulse for a full minute. For the sake of time, I just took it for 30 seconds and multiplied it times 2, which would be 75. But normally you listen to the pulse for a full minute. Her respirations were 12. And you would also take a blood pressure at this time. You don't have a blood pressure cuff, but you would take a blood pressure at this time. And this consists of your vitals. This time you also assess skin. So like I said, her skin looks good. She appears to have good turgor. You check it up here by the collarbone. She appears to be well hydrated. But as we go along throughout the assessment, I will be looking at the skin with each part of the assessment as I'm going. All right? Great. Okay, so we are going to keep going. I'm going to start with your head. I'm going to start feeling through your scalp. Okay. All right, scalp is free of lumps, no lesions noted, no dandruff. Seems it's clean. Well, hygiene is well kept up. Yeah, so that looks good. And I'm going to continue on and do the temporal arteries. Okay, the temporal arteries are equal bilaterally and they're +2. Just have to look at my notes really quick. Okay. Alright, so now I'm going to keep going. I'm going to check your sinuses. Sinuses here, and then by the cheekbone. They feel good. You don't feel full. Is this tender at all for you? No. Perfect. And that looks good. I'm gonna ask you to open up your jaw. So the TMJ joint is there, and there is a slight clicking, but it is intact with a slight click. Now we're gonna continue, and I'm gonna go on and do her eyes. Let me get. I'm going to get my ophthalmoscope, and I'm gonna look in her eye, and we're gonna look for her corneal light reflex. Okay. So her eyes, both of her eyes were equally dilated and constricting with the light and accommodated and reactive towards the light. Both of them were equal. Now we're going to look for the red reflex. I'm going to turn the light down just so it's not it's not painful for the patient. Make sure it's at a good brightness so it's not blinding her. Okay, I'm going to ask you to look at that far corner up there. Let me turn up this angle so you can see a little better. Okay, I'm going to ask you to look up behind my head up into this corner, okay? I found the red reflex. Now I'm going to follow the blood vessel and hopefully try and find the optic disc. Okay, optic disc is medially located and it is a cream color and is surrounded by blood vessels, so it looks healthy and what it's supposed to look like. For the sake of this assessment, I'm just going to do her one eye, but normally you would do both her eyes and just make sure that they're both equal and you're able to see the optic disc and those blood vessels around it are normal and patent. Okay? I'm going to ask you to, maybe you might need to sit up for this, but we are going to test your cranial nerves, okay, which is cranial 3 and 6. Alright, yeah, that'd be perfect. You could just, perfect. Okay. So, just give it a good time. Okay, let me turn this way, this one's me better. Okay. Okay, I'm gonna ask you to follow my finger. I have, perfect. Okay. Okay, perfect. So patient's cranial nerves 3, 4, and 6 are intact. Both her eyes followed great, and she did good. Okay. So again, still looking at her eyes, so her sclera looks clear. She has no signs of irritation or drainage. Have you had any problems with your eyes recently? No drainage that you've noticed, anything different?
No.
Okay, perfect. So patient denies any drainage. I haven't seen anything. Her eyes don't seem to bother her, so they seem normal and good. Okay, perfect. All right, so we're gonna keep going, and we're gonna keep going with the ears. I'm gonna get my otoscope out. it. Perfect. Okay. And I'm just gonna look at this ear. First, you always want to just look at the outlining structures. The structure of your ear. It looks good, and it doesn't look like there's any foreign objects or anything, any lumps, any cysts, or any kind of anything in here. So the structure looks good. So I'm going to go ahead and advance the otoscope into her ear. Sorry. Perfect. Okay. Alright, so I was able to see her tympanic membrane. She has some earwax surrounding it, but her tympanic membrane is pearly, it's shiny, what it's supposed to look like. It looks healthy. Do you have any pain in your ears? Do you have any pain in your ears? No. So her patient denies any pain, and her ear looks good, looks healthy, pearly, like I said, pearly and shiny, what it's supposed to look like. And like I said, normally you would do the ears bilaterally and make sure that they're both clean, but for the purpose of this video, I'm just going to do one ear. Okay. So we are going to keep going. Just put this away. Okay. I'm gonna still moving with the face, keeping on going with the face. I'm gonna do her nose now. Which I do still need this for. And I'll use this light to check for patency. And I'm gonna ask you just to please blow out through both of your nails. Okay. And by doing this, you check for patency. You check that she does that without ease. And now I'm gonna look in her nose to see if her septum is deviated or if there's anything that looks abnormal in her nose. Have you had any troubles or problems with your nose at all? Okay. So her nose looks patent, seems patent from her breathing, and her septum looks clear, looks straight, no sign of deviation at all. Have you ever had a broken nose? Okay, perfect. So that's consistent with my findings that she has a straight and not a deviated septum. Okay. Alright, so we're going to keep on going. We're going to move on to her mouth. Alright, her lips, they look pink, no lesions or no cracks. She seems well hydrated, and so we're going to keep going with her. Her mucous membrane looks pink, no signs of lesions. No bleeding. She has an intact soft and hard palate. Those both look good. I'm going to ask you to open your mouth and say ah.
Ah.
Perfect. Okay, I was able to visualize the uvula, and her saying ah is, it demonstrates that she has intact cranial nerves of 9 and 10, and her uvula is good, and it's medial, and her, like I said, her mucous membranes, they don't have any lesions, and so they're good. I'm going to ask you to stick your tongue in and out. Perfect. Okay. By doing this, you're having them, and she's able to demonstrate that her cranial nerve 12 is intact. So that's good. Okay. Alright, now I'm going to take a quick look at my notes, and then we'll keep going. Okay. The only thing I missed is just also, since you're there in the mouth, you're also going to check that all her teeth are there and that they're not decaying or anything. There's a problem with them. So while you're in there, make sure you assess the teeth as well. and all her teeth look intact. There doesn't seem to be a problem at all. Do you have any discomfort or any pain in your teeth at all? Oh, perfect. So her teeth are all there, they're all intact, and she doesn't seem to have any problem, which is good. All right. Right, I'm going to ask you to sit up. You can sit up, yeah, that's perfect. We're going to start moving down, and we're going to go down to your neck. Okay, so first, almost with every, let's turn this up a little bit. Almost with every part of the assessment, you're going to look, and like I said, you're going to look before you start touching, so you start feeling. So we're going to look at her neck, look if there's any bumps, any goiters, sign of thyroidism or any thyroid disease, but her neck looks good. It appears to be symmetrical. It looks good, it appears to be symmetrical, and so now we can start palpating. My computer shuts off, so that's why I keep touching the computer. But, okay. Okay. Okay, so what I did is that I checked for any lumps or bumps or anything, and you also here want to check for, you want to check for her lymph nodes. You want to check for her lymph nodes, make sure there's not any inflamed, any signs of infection, and if there is, you would ask if she's going through any sickness or anything, but I didn't feel any lumps and I didn't feel any enlarged lymph nodes. What I also did is I also checked her carotid pulses. And this time I made sure that I didn't check them both at the same time, so you're not occluding those arteries. So you check them one at a time, and they're both equal bilaterally, +2. So they were both good. Good, okay. But I'm going to ask you just to move your neck around. Just around like in a circle. Good. Good, and that's, she's demonstrating she has good range of motion. Good, 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 good. Good, okay. Now I'm going to ask you to push against my hand. Good, good, good. Push hard against it. Oh, good, good. So here she's demonstrating that that her cranial nerve 11 is intact. Good, thank you so much. That was great. Okay, so now we are going to begin. We are going to do the chest, and I'm going to begin with the back side of your chest. Is that okay? All right. Okay. So here, you ask your patient. Maybe we'll ask you to turn this way. Yeah, that way you ask your patient to. You will want to lift their shirt just so you're able to inspect everything, make sure that there's no lesions, bumps. Same thing, that you're able to really assess the skin. Okay. So here I'm inspecting her back. Alright, there's no signs of lesions. Her skin looks tan, it's even. Sorry, I'm in the way of the camera. Her skin looks tan, it looks even. Like I said, there's no lesions, it doesn't appear to be any kind of circulation compromise or anything, so all that looks good. So now that I've done that, I'm going to advance, keep going, and I'm going to palpate. Okay. Alright, so I felt no lesions, no bumps, and all that looks normal, and it felt normal as well. Okay, so now I'm going to continue. I'm going to listen. Okay. So, in and out. breath sounds are equal. They're clear and they're bilateral, which is what you want to hear. Okay. After I listen, I'm now going to percuss, and the sounds that you want to be hearing is you want it to be resonant over where it's not bone, so where it's not rib. So you want to make sure that you're trying to skip the rib and you're able to percuss the actual lung and make sure that it's resonant, that there's no consolidation or anything. Okay. Lungs are resonant and there's no sign of consolidation from what I can feel. One thing that you also want to do is you also want to check for symmetry and expansion. So the way you do this, I don't know if you can see, is you put your hands on their back right here and you ask them to breathe in, breathe out. Breathe in, breathe out, please. Okay. And here you will see your hands move evenly in and out. If she had an type of asymmetry in her breathing, in one hand you move out, or you'd be able to see it in your hands. So that's a good thing to check for equal expansion. I percuss. I am now going to check her diaphragmatic excursion, which usually should normally be between 3 and 5 centimeters. So I'm going to ask you to breathe in and hold it. Okay? Breathe in. You can take a break, chill out for a little bit. Alright? Okay, now I'm going to ask you to breathe in and exhale. And hold it. Alright, breathe in and exhale now. Okay, perfect. And so her excursion that I measured was about 3.5 centimeters, and that's a good thing to check. You do that by asking them to breathe in as much as they can and then hold it and mark that measurement, and then you ask them to breathe out and you measure the distance between those two. So I said hers is about 3.5. It's good. And now once I've done the back, I'm going to go ahead and assess the front of her chest. Thank you so much. And the same concept applies when you look at the front. You're going to do that look, feel, listen type of thing. So, okay. So, yeah, like I said, you're going to look, feel, and listen as well. So I'm going to look for skin here. Skin looks good. Alright, skin looks good. There's no apparent signs of lesions. Her skin looks good. Like there's no compromise or apparent compromise of circulation. Here you could go ahead and do the. You can also palpate at this moment. But I'll do it up top here, just to palpate for any lesions or lumps. Do you feel any tenderness? And that's feeling. Now I'm going to listen. You'll listen to the front lobes as well. And her legs sound beautiful, both bilateral, clear, and equal. One thing that I just realized I forgot to do is when she's on her back, you do the tactile firmitis, and that's checking for resonance. So I'll ask her to do that now. So maybe go sit up. Perfect. That's perfect. That's perfect. And you'll put your palms or like a bony part of your hands on her back, and I'm gonna ask her to say blue moon, and you'll be able to feel the vibration within your hands and seeing if it's equal. So that's what I'm gonna do now this moment. Say blue moon.
Blue moon.
Say it a little deeper. Blue moon.
Blue moon.
Perfect.
Blue moon. Blue moon.
Alright, so both they're resonant on equal sides, so that's good, and that's what you want. Alright, we're gonna keep going, and I'm going to now go to the abdomen. For the abdomen, same concept like we were saying. You want to be able to look, because you don't want to be palpating if you feel like there's a mass or something there. So definitely always start by looking and then keep going if you feel like you can. Okay. So her abdomen, her skin looks even. She has a little bit of hair here, which is, I mean, that's good. It's apparent of good blood flow. So her skin looks even. It's consistent with the rest of her skin and her body. It's tan. There's no signs of lesions, no signs of cracks. Her skin continues to look well hydrated, which is all good. Alright. And now I am going to listen. I'm going to be listening for her bowel sounds as well as aortic breathes. Okay. Okay. Her bowel sounds are very active, and I was able to hear some aortic breathes. But just by looking at her stomach, I don't see any impulses or anything. They're not apparent to me at the moment. But now I can continue and I will palpate. Start with light palpation, just to make sure it's not painful for the patient at all. And then if they are able to tolerate that, you can do some deeper palpation. Does that feel okay? It's not any pain at all? No. So I'm going to go a little deeper. So no masses or lumps occurred, and she denies any tenderness, which is good. At this moment in time, you can also try and feel for the border of the liver. Sometimes it's palpable, sometimes it's not. On some people it is, and some people it's not. It just depends. But the way you would do it is that you ask them to inhale and exhale, and that's how you would be able to get somehow around it and be able to feel the border of the liver. So we're going to try that now. Can you take a deep breath? And then take a deep breath and hold it. Okay, so take a deep breath. Okay. I'm not able to feel the border, but normally on some people it would be under here. And now you can also assess for the spleen and look for the spleen. The spleen is even less palpable, and that's normal because it should be hidden behind in your rib cage on the left side. So a lot of times if you're able to palpate the spleen, it's a problem because it is enlarged. But we are going to do that now. So breathing and hold. Okay. I'm not able to feel the spleen, which is okay, and that's normal. Like I said, if you were able to feel the spleen, sometimes that would be a possibility of it being enlarged and would require further investigation. Okay. I'm going to take a quick look at my notes and we can keep going. Okay. Alright, we're still here. We're now going to assess her cardiac. Cardiac, I'm going to assess her heart rate and her, and make sure that all that is good. So I'm going to listen to her heart rate. And here you will be listening for the apical, the pulmonary, the tricuspid, and the mitral valves. And that's what you do. You listen to your S1 and your S2, and you listen usually to your S1 for a full minute. Because that's when you'll be able to catch any murmurs or any swishes or any abnormal sounds for your mitral. You really want to listen for a full minute. She had a heart rate of 71, and here I didn't hear any murmurs, I didn't hear any swishes or any abnormal sounds, and that's why you usually want to listen for a full minute, just to make sure you're able to catch any of those extra noises that you would want to be able to find. All that time is good. Okay. Now I am going to we're going to do the upper extremities, and I'm going to ask you to say. Okay. So, same thing, you're going to inspect for color, you're going to inspect for any lesions, any type of those things that you would look like you would look for any other section. So you want to do that. You feel for muscle equalness. Sometimes, I guess if they're predominantly a right hand or left hand, there might be a marked increased strength or muscle in one arm or the other, but hers seems equal for both of them. her grip strength is equal and it's strong on both sides. Um, Now that we're here in the arms, I am also going to do her reflexes. So I'm going to get my reflex hammer and we're going to go ahead and do her reflexes for her arms. So we're going to get started with the tricep. You want to hang her arm out and make sure it's like dead weight. And make sure she's able to swing her arm out. Okay. You want to hit at the top of her elbow. Make sure you're staying free, like you're carrying, like I should be like I'm carrying your weight. Just perfect. There we go. Okay. So she had about a +1, maybe I'm not just doing it exactly right, but she had about a +1. And normally you would do it on this hand and on this hand, just make sure they're equal and you're getting both the reflex for the sake of this video. I'm just going to do one side. And then I'm going to move on to her bicep, which is go on and find her tendon. Go with them. Think of warm, sunny beaches. Perfect. So she had a great +2 reflex. I mean, you were able to see it, and that was great. So she had a great reflex. Now we're going to do the brachioradialis. And make sure that they're loose. They're not really thinking about, sometimes they psych themselves out when they're thinking about what the reflex should look like or what is that. But like I said, think of warm sunny beaches like you're not even here. Okay. And she had a good +2 reflex for brachioradialis, so that was great. Like I said, normally you would do this on both hands and make sure that those are both equal. For the sake of this video, I'm just going to do one side. Great. That was great. And now we can continue and we can do our neurological system. Since you're just hearing the reflexes, let's just go ahead and I'm going to do her lower extremities. I'm going to check her pulses down here, and I'm also going to check. Okay. I'm also going to check her reflexes, her popliteal, her patellar reflex. Okay. So here, normally you would, since you're doing lower extremities, you would also check for inguinal arteries. You would check for the lymph nodes. So I'm not going to do it on her, but normally during the assessment, you can either ask her to do it or do it with a gloved hand with the stethoscope and feel the arteries and the inguinal lymph nodes. So definitely always still want to keep those in mind. But we're going to keep going, and I'm just going to I'm going to start checking her pulses. So let me move the camera so you're able to see what I'm doing. Those are her feet. Okay, so here, like I said, you're going to look at the skin as well and make sure that there's not any lesions or bruises. She has a couple of scars on her knees. I'm sure that's from falling when she was younger. Do you have any concerns about her legs or any of your scars? Probably things.
No.
Okay, perfect. So she denies any problems or anything, so all that looks good. So her skin looks good. She has evidence of hair growth. Like I said before, that's a good sign. You want that because it sounds a good sign of blood flow. If you have some missed patches or patchy legs or patchy hairs where you feel like there should be hair, that shows that there's some type of compromise within the blood. Okay, so let's check her popliteal artery. Okay. Okay. Both her pulses are equal to bilateral and they are +2. So we're going to go back and I'm going to do her posterior here behind the ankles. And those are both equal bilateral, and they're +2 as well. Sometimes it's harder to feel these next ones, which is a dorsalis pedis. Usually, you need to take off their socks to be able to feel it. Is it okay?
Yes.
Oh. Hers are actually not hard to feel at all, and hers are equal to bilateral and they're +2, which is quite. Actually, now that you have your socks off, you'll still you want to check her feet, and you want to check her toes and make sure that those are both that they're all there, and she has a good practice. She has some toenail polish on it, but I'm still able to check her calf bone, which is licensed and it's good. Okay. So you can see her knees. We are going to do the patella reflex after the exercise. Okay, before you. And like I said, her feet, her feet both look good, and there's no sign of lesions or compromise of circulation, and that's what you want to keep looking in all areas, and especially a lot in the feet, especially in diabetic patients. You want to really do good, meticulous look and care for their feet, and make sure that there's not any open wounds or anything that they're not able to feel or assess because they can't feel it. Okay, so up. Anyone might ask you to sit on a couple pillows so your feet are actually dangling. That's good. Okay. So perfect. You had a great reflex. It was a +2, which is great. That's what you want. Sometimes it depends on if you're hitting it right, but like I said, I do normally do it on both sides. I'm just going to go into it for the second time. That's good. Okay. Now we're going to keep going and we can do her neuro. I'm just going to take a quick look at my notes and make sure I haven't missed anything. Okay. All right. What we're going to do is I am going to just ask you to close your eyes and I'm going to ask you if you feel this, okay? You able to feel that? Okay. Does that feel equal on both sides? Yes. Okay. And you can do this sensation, seem to be feeling it throughout their body. You can do it around their arms. So you can feel that. On their legs as well, and to check for sensation and that they're able to feel all that. Okay, and now what I'm going to do is I'm going to take a sharp, and this is going to be my sharp object, and this will be my dull object, and seeing if she's able to recognize what is sharp and what is dull. So I'm going to ask you, we can raise the camera now. I'm going to ask you to identify, if you close your eyes, and then if you're able to identify a sharp or dull object, okay? Okay. We'll just do this around here. Sharp. Dull. Dull. Sharp. Let's do that again. Dull. Maybe I feel like I'm not pressuring this right, so let's try this again. So make sure you're doing it accurately. I feel like I've been putting it flat, so that's going to be dull. So, sharp. Yeah. Dull. Good. So yeah, just make sure you're doing it so you're not confusing yourself or your patient and making them feel like something's wrong. Good. She's able to identify the objects. Now I'm gonna ask you, again with your eyes closed, I'm gonna ask you to extend your hand this way and then touch your nose. And then do that with your opposite hand. Okay, now again, but faster. Okay. Now I ask you to extend your arms out, just like that, and hold up. And then do it again but with only the tips of your fingers to your toes. I mean to your nose. And then, perfect. Now do it faster. Okay, perfect. Here, when you're asking the patient to do this, they are demonstrating that their cerebellar function is intact. You do this as well as something else to do. But that's what you do. You do that to test their cerebellar function, and that seems to be intact, which is good. You ask them to do it faster as they can, and that shows that they are able to demonstrate proper cerebellar function, and that's intact. And the other one is the heel to shin. So here, I'm going to ask you to, if you can, touch your heel of your foot to your shin, and you can slide it down to your foot. Okay. By doing that, she is also demonstrating proper cerebellar function, and that's intact. We've gone over our cranial nerves as we've been going through the general assessment. If there's anything else, what's left to do now is the musculoskeletal. So I'm gonna move the camera and I'm gonna ask her to walk across the room until we can see how her gait is and make sure that she's walking freely. Okay, so if you want to stand up and just walk across the room. Good, now turn back around. Okay, perfect. Okay, so she was able, and she demonstrated that she can walk freely. Her gait is even. She has no problems walking, and she walks heel to toe, which is what you need to do, and she can walk in a straight line and come back. So she walks with ease, which is what you want. Okay, we are now. I'm gonna ask you to stand up again, and we'll do the Romberg's sign. Maybe we can get there. Perfect. I'm gonna ask you to raise your arms out. Close your eyes. Good. Hold it. Okay, good. And that you're just looking for any movement, any extra movement, and that she's able to keep her balance, which she is, which is good. That's what you want. Now I'm gonna ask you to touch your toes. Okay. Perfect. Okay. And here, come back up. Okay. Here she's demonstrating that she's able to lean over. Great. I'm gonna ask you that again, to bend over again. And here you can actually lift up your shirt and look at her spine and make sure that it's even, no sign of scoliosis, which it is. She has good range of motion in her spine, and it looks great. You can come back up. Perfect. Okay. I'm going to take a last look at my notes and just make sure I haven't missed anything. Okay? All right. Okay. So I don't believe I missed anything. The only thing that I haven't gone over, we didn't go over breasts and we didn't go over genitalia, because those are the things that we went over in class. But that's what you normally would do. You would check the breasts. You would go up and you would check the tailspins. So you would look for the lymph nodes as well, because there's also possibility of finding lumps and dangerous things there. So you want to make sure that you do a good palpation of that and do the row motion, the up and down. Same thing with the genitalia of the male and also for the female. So you do want to include that in your general assessment. But for the purpose of this video, I'm not going to. But I think this is it, and just this is my complete health assessment. Thank you.